Hey, I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, chiropractor for since 1980.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
We have a chronic pain practice that is developed over the years by melding these two disciplines, brain and nervous system and everything else, okay, relative to functional medicine and the chemistry of your GI system as well as your immune system and so on and so forth. And what we have found in chronic pain is that it's a full body type of thing. There's a lot of vicious cycles involved. And we see a lot of things here because we see a lot of patients. We've treated a lot of Lyme disease. We've treated a lot of Epstein-Barr. And we have seen a lot of people who have come in with mold. They have not come in to get treated for mold, but they have come in with many of the symptoms that have been ascribed to mold. Mm-hmm. And Dr. Gates does a tremendous amount of research. Anybody who has watched us and bothers to check our research out afterwards, they're usually attached. I mean, we must have 1,000 studies out there or more now.
Probably in total, yeah.
Relative to the things that we talk about. Yeah, relative that we talk about, at least. So we feel like we're in a position to try to help people to maybe clear things up. The title is Toxic Mold, Setting the Record Straight. It's a bold statement. I get it. You know, like who are you guys to set the record straight? We're the guys who see chronic pain every day, and we get to kind of see things happen. We called the Lyme issue on it being autoimmune years before, even though the one lady that commented on our Facebook said, I thought everybody knew that it was autoimmune. So maybe we were years behind. I don't know. But it just came out in February that is Lyme is actually an autoimmune problem. Toxic mold, we're gonna argue in a similar vein. But what we're gonna try to do for you is kind of say, look, here's where the CDC is, the Center for Disease Control, and here's where the alternative group is, and where do they agree, where do they disagree, and what have we seen in patients who are consistently recovering in our offices from this, even though technically we're not treating them for mold. Kind of an interesting perspective for those of you who've really been digging. And I had the opportunity to look over about 30 histories online in the last hour. And I'll share with you some of the things that I noted there as to why these people might be floundering around relative to their confusion as to, is mold this or is mold that, or is it even the cause, or is it everywhere, and things of that nature.
Right.
So, so we're going to talk about toxic mold. We're going to talk about what we have learned from the family in Hawaii, which I have no clue what we learned from the family in Hawaii. So Dr. Gates is going to talk about that. And differing opinions on the mold camp, differing opinions relative to the Center for Disease Control, what the research is showing, and what we're seeing. Okay, and what we're seeing that has consistently been successful in helping these people to get back to a normal life and be able to control their, at this point in the talk, their mold condition on their own, once they've gotten better. So, symptoms of toxic mold.
Symptoms of toxic mold include respiratory symptoms. That's the primary one mentioned in the infectious disease community and the allergy and asthma community. Also, they discuss skin lesions as a possibility. Sinusitis, obviously, that goes along with respiratory issues. And then we start branching out into things like headaches, chronic fatigue, and these symptoms are more contentious in the literature as well as in the medical legal arena, and we'll talk about that arena as it pertains to toxic mold, because that's a big reason why many of you are still somewhat confused as to what's going on, because there's so much debate within the courtrooms regarding the effects of mold, because frequently we're talking about workplace environments. Other symptoms include cognitive impairment, and that's constitutional symptoms, so weight loss, fevers, chills, things of that nature. So those are the symptoms. But I think we should go right into kind of what the CDC says about toxic mold exposure.
Perfect.
And the CDC, that's our primary a government infectious disease agency overseeing vaccinations to public health issues to bioterror problems, and they coordinate with other government agencies. And relative to toxic mold, in essence, the CDC says, and probably many of you know this if you've read on their website, that toxic mold exposure, especially with Stachybotrys, which is the black mold, will cause respiratory symptoms, it will cause allergic symptoms, and once the mold is eradicated or removed from the environment, so you scrub your walls down with special agents, then you really should be asymptomatic, and there are no lifelong or prolonged illnesses associated with that mold exposure based on the current research, according to the CDC. In today's broadcast, we'll talk about some of the flaws in that research, and this weekend I went into the research, and I'll tell you frankly, there's not a ton of research on toxic mold on both sides of the coin. Not nearly as much as one would hope. A lot of the research was in the late 1990s, the early 2000s, when this was more of a hot topic.
And given how serious it can be, and we're going to discuss, we're not saying there's no mold problem, by the way, okay? I mean, we're here in a very old building. I like old buildings. So we got this old building which fit our needs. Mm-hmm. And not shortly after found entire walls of mold. Mm-hmm. And so we let the local authorities know. They came in, and wow. I mean, you talk about an operation. I mean, with the whole thing, with the hazmat suits, right? and the big oval, like they look like slinkies or something, mm-hmm. where they would
ventilation systems,
so that ventilation systems, so they would walk from there outside without having it spread anywhere else, and so on. So somebody gets that.
Right.
It's potentially serious. A very, very serious problem. Okay. And so, but yet, as Dr. Gates says in our, and I was looking beforehand, there's not a lot of hardcore, really good research on this. As a result, we have also an opening for the alternative world to say what?
They're saying,
I could summate it and say everything is mold, but
that's pretty much it. So, in reading a lot of the alternative websites on mold, probably many of you watch this broadcast have been all over those, and maybe you wholeheartedly believe in everything that you're reading. And we're not criticizing you, but what we are saying is that we think that maybe the issue is a little overstated on some of these alternative websites, where they're basically ascribing every symptom under the sun to toxic mold exposure. And that creates a slippery slope for a lot of patients, because now they're saying, well, it just takes a little bit of mold for you to be having these XYZ ABCD symptoms, when in actuality, in our experience, maybe there are other factors going on in addition to the mold. And yes, maybe the mold was a trigger. We're not debating that. We're not refuting that mold is a problem. But what we are saying is that you kind of got to look at this issue in its entirety, and you have to look at a person in its entirety. We've had patients come in who've had toxic mold exposure, when in actuality, they did have signs of autoimmune disease 20 years prior to the toxic mold exposure. Now, that's not to say the mold's not a problem, but you have to evaluate the entire person.
And to just say, in some, I don't know if I want to say justification or validation, the reason that these theories have evolved, not just in mold, but in Lyme and in Epstein-Barr virus, because chronic illness has been around for a while. I started getting interested in it literally in 1987. And I didn't get really heavily interested in it until I got extremely sick in 2002. But all along the way, I've had colleagues who are medical doctors who bucked the system, and we're trying to figure this out. But in all fairness, in Lyme and in Epstein-Barr virus, there's lots of data out there today. Yeah?
True.
Okay.
True.
And the newest data in Lyme says it's an autoimmune problem. Okay.
Right, which is going against what everybody thought.
But for years, doctors were struggling to answer, why are these people suddenly getting so sick? And at that time, I'm talking about a time when maybe 25,000 people in this country were considered to have chronic pain syndromes. Mm-hmm. Now depending, even in the last 2 months, different estimates are like 130 to like 160 million, half the population. So the struggle to understand these things led to diagnostic attempts that today we would say are questionable, mm-hmm. because the research shows that they're questionable. But at the time, they weren't questionable. They were the only thing people had to cling on to. The problem I've seen, I've been in practice since 1979, okay? And the problem I've seen is as the new data is coming out, we're resisting, that group is resisting going towards the new data.
That's true.
And in defense of the mold guys, there's not a whole lot of new data out there.
Mm-hmm.
We're going to tell you what we've seen, because this is new data. I mean, we're doing an ongoing clinical trial here, basically, if you will, treating chronic patients within a logarithm that we've produced, and the mold people fall into that category.
Absolutely, that is accurate. So to expand on that just a little further, with the kind of want to talk about the data in a little greater detail. So there was a great study that came out from Hawaii. So it was a Canadian family that moved to Maui, and they were living in a mold damaged or water damaged house that then had a significant mold and other bacterial infections associated with it. That's common. Hopefully many of you know that. When there's mold, usually there's other bacteria growing in the walls and things of that nature. So his family was exposed, and the dog developed 72 skin lesions. What was excellent about this case is that the supervising neurologist really took note and made sure he covered all of the bases in getting these people adequately evaluated by specialty centers, so that there was no question on the legitimacy of their symptoms, their signs, and their diagnoses. And so he evaluated every patient. It was very interesting with his evaluation, which was very thorough, kind of akin to our evaluation. We're not saying that egotistically, it's just we do a really long exam.
Oh, I want to talk about that.
And in doing so, he saw a lot of just odd neurological signs with these mold patients. And we've seen that with mold patients too. You should be able to do this with your hand really quickly, and the mold patient may be like, and maybe it's not severe enough for you to say, okay, that person has a tumor in their cerebellum, which coordinates that function, but it's just not right. And so he was seeing those sorts of signs. He was seeing when he put their feet together, they would fall over, as we commonly see. But again, they didn't have a tumor or a stroke in their brain. And then he sent them to Atlanta, Georgia from Hawaii to be evaluated at a specialty ear, nose, and throat facility, where those doctors basically found that they had significant sinusitis problems, they had pressure behind their eyes, they did document their headaches, they documented their chronic fatigue, so on and so forth. One of the children developed a ton of rashes, in addition to having neurofibromatosis, which I don't know if they were, neurofibromatosis is really a genetic condition, so I don't know if they were trying to say that the mold kind of triggered this genetic condition to come on faster. Nonetheless, this is our best documented case in my review of the literature that we have. And so we can really definitively say, yes, mold can precipitate not just allergic symptoms, but these other neurological signs, these other features such as headaches. There's a gentleman by the name of Dr. Gordon. He's a medical doctor who has been a big mold proponent. However, he is attacked viciously in the literature by, quote unquote, skeptics. But after their attacks, really the science didn't really go anywhere. So again, going back to what Dr. Rutherford kind of alluded to, in the last 5-6 years, we haven't had a lot of good data on toxic mold exposure. Most of the studies from the allergy community, these are big time allergists, say, we need to look into this further because these patients have more than just respiratory symptoms. But then there's no other studies to really look at it.
Right. And so you have this whole group of doctors who have been doing this. Many of my colleagues since the 80s have been working with this, and maybe longer than that, and saw intermittent types of situations. I remember one gal that I was treating as a car accident case. She wouldn't get better. They were one doctor was telling her it was a mold exposure, and then all of a sudden that was stopping her from getting better from the adjustments, and she had every symptom you could imagine. And then one of my colleagues took her off of wheat. Okay. We called it wheat back then. We didn't call it gluten, okay? One of our colleagues took her off of wheat, and all of a sudden her symptoms started going away. She started responding to the adjustment, but she was convinced by the mold doctor that it was mold. I'm not saying that's a bad person. We're talking the 80s, okay? We're talking like the infancy of this. People were struggling to try to understand what was going on with this. Now, I can conjecture on a lot of the reasons is why people aren't changing. doctors either really still think mold is everything. Doctors either don't want to change because it's difficult to change an entire practice that you've had forever and ever and ever and ever and ever. And I can go on from there. But what we have seen is relative to people being a compromised host already when they're exposed to mold, correct? And here's the interesting thing. I didn't do this until just an hour ago. And I went online and I looked up one of the mold sites and I read the histories of every person. I moved into here, I did that, I did this, I developed fibromyalgia, I used to be a weightlifter. And what was lacking in every one of those histories was there was no history. That was their history. Their history wasn't I don't know what their history was before. Did they have immune problems? Did they have a family full of immune problems? Did they have Hashimoto's thyroiditis? Do they have post-traumatic syndrome? These things compromise your immune and results in people coming in here, fibromyalgia and Lyme, or fibromyalgia and Epstein-Barr virus, or fibromyalgia and mold exposure. And we are very respectful when people start telling their stories because it is significant, but it's not significant maybe in the way that you have educated yourself to be. So my continual ongoing daily part of this practice is to try to help people unlearn what they have learned so they can embrace a model that has shown to consistently help them to get better. Now,
you said it perfectly.
I did say
because
it perfectly,
a lot of mold,
because
I've read on the mold forums too, where, basically skeptics will say, oh, well, you had PTSD before you had the mold exposure, so that's the cause of your symptoms. And the mold patient who's suffering becomes irate because they're saying, no, all my symptoms started once I was exposed to the mold. The reality of the issue is that you're kind of both right. And so the PTSD may have set you up for an immune system imbalance that you had in childhood, if you had PTSD, just as an example.
Or if you were just undergoing a tremendous stress.
Right, and those cortisol fluctuations will imbalance your immune system such that when you're exposed to the mold, maybe that's enough to allow your immune system to become really out of balance. And as a result, for you to develop this mold toxicity syndrome with all these other symptoms aside from allergic rhinitis. So that's the more specific aspect of it. Now, immunologically, we kind of have to do just a brief course as to what's going on with your immune system.
We're going to argue it's an immune problem.
It's an immune problem.
The same way as Lyme is an immune problem, the same way that Epstein-Barr virus is an immune problem. Killing the Epstein-Barr virus, killing the Lyme, if you've been exposed to those two things and you don't get to them right away, you're going to develop all these symptoms because they are screwing up your immune system.
Absolutely.
This is going to be it. Our argument is going to be the same because this is what we observe. We have no axes to grind here. We're just telling you this is what we see every day.
Absolutely. So with your immune system, you have two sides to your immune system generally. One is called the Th1 side, one's called the Th2 side. We are aware this is an imperfect model for all of you immunologists watching out there. There are many details to this, just so the lay public knows this. The Th1 side is generally the mono-immuno combat of the bacteria, the virus, the fungus, the mold. Whereas the Th2 side is more the remembering of the previous infection, the targeted precision killing of the mold in this case. Now, these two sides of your immune system should be really in balance. Now, if they're out of balance, that can be a problem. And we see that in most autoimmune diseases, there's an imbalance of either one side or another. And you have this other guy in the middle called your T regulatory system or your Th3 system, which is powered by vitamin D, amongst many other things. It's largely in the gastrointestinal tract where 70% of your immune system is. That's where these immune cells reside for the most part. And so this regulatory system is always trying to keep these two sides in balance. However, when someone is exposed to a bacterial or a fungal infection, there's this other guy called a Th17 response. I know this is a lot of data, but hang with me. Th1, Th2, regulatory guy in the middle. The Th17 guy is kind of like an evil dictator, and it can get turned on with things such as fungal infections, and then it can promote autoimmune disease. And one of the ways it promotes it is by further imbalancing this Th1, Th2 issue. So that's how an infection can then lead to an autoimmune disease. And that's what we're seeing with this, I don't know, this kind of differing opinions, or these differing opinions between the alternative community and the infectious disease community, because for the longest time, the alternative community has been saying, oh, chronic fatigue is Epstein-Barr virus. Oh, you know, Lyme disease, it's absolutely about the Lyme bacteria, and then it's Babesia, and it's all these other co-infections like ehrlichiosis. And so that's what we have to focus on. They're partially right, but they're not entirely right. Just like you, as the mold sufferer, and maybe your mold literate doctor has been telling you about taking, you know, all these different herbs and chlorostomine to help you with the mold infection, when in actuality, it's really your immune system that is the primary problem. And what we see with most autoimmune diseases is that there is an infectious component and there's an immune imbalance component. We talked about it in the Lyme broadcast. So with rheumatoid arthritis, we find that there are infections coming from the gastrointestinal tract basically being found in the joints. But that's not the whole problem. With Hashimoto's thyroiditis, 80% of patients have a virus living in their thyroid, but they have other issues associated with their gastrointestinal tract. And so the key factor for the mold sufferer is for you to realize that, yes, the mold was an issue, but if you're out of the mold now, you moved out of the mold environment, and you're still responding to tiny amounts of mold just sitting on the shelf that is barely perceptible to any other individual, this whole immune dysregulation aspect is what you need to focus on. You probably have chemical sensitivity, probably your liver's not working correctly. Go back and watch our multiple chemical sensitivity broadcast.
Yeah, then you're getting maybe skin rashes, maybe you're getting sensitivity to shampoos or hand lotions or metals or something like that.
Yeah, absolutely. And so anytime you go to an alternative practitioner, just be wary that they're going to focus on whatever it is they do. So just as Dr. Rutherford said, they may say, oh, yes, it's a mold, but you have heavy metals.
Whatever the test says.
Heavy metals are causing your problem. Heavy metals may be causing your problem, but take a step back and look at the entire immune system. And really where most of the immune system is right here. That's what our experience has shown. We've dealt with mold cases, we've dealt with Lyme cases, we've dealt with every autoimmune disease pretty much under the sun. And so much of it traces back to here. We're not saying this is the only thing. We're saying the infection has to be paid attention to. We recommend that people not be living in an environment infiltrated with tons of toxic mold. But when most of our patients are not in that environment, they're still having these symptoms. And that's why you have to focus on the immune balance issue, regulation of the immune system, as we outlined.
Yeah, everything Dr. Gates just outlined, every viral, every bacterial infection, every toxic infection, all of them attacking the thyroid, every single one of them did the same thing. They exacerbated your immune system. By the way, if you have these conditions, your immune system is overactive. It's excited. So you don't need to be taking herbs and botanicals to boost your immune system. When you have an autoimmune problem, the medical profession gives you a steroid to crush your immune system so it stops attacking the nerves in MS and the joints in rheumatoid arthritis and so on and so forth. So I've heard a lot of people coming in here, I got mold and I'm taking this immune booster and I'm not feeling good, or I have Lyme and I'm taking this to boost my immune system. I'm having a Herxing effect, which is a whole different thing in our world unto itself. So the whole thing is the mold. Here's how it goes. If you're listening to us and you have mold and you look back in your history, I'm going to bet you have a family history of either stress or immunity. That might be a family history of chronic thyroid problems, chronic gut problems. It might be actual autoimmune problems. Maybe it's just that you get sick all the time, but you're going to have some sort of effect. Maybe you were a kid and you had bad gut. You're going to have a family history that caused you to be what we call a compromised host. Your ability to withstand an attack on your immune system is decreased before you get the mold exposure. You now get the mold exposure. The mold is a trigger and perpetuating the immune system. And any of the things that you might have had before, let's take something obvious. Dr. Gates just said rheumatoid arthritis. So let's say you had rheumatoid arthritis before, but maybe you didn't know it, or maybe you knew it, but it wasn't causing a bad problem in your knuckles. You didn't have, now you get the mold infection. Now this starts going, now your thyroid starts going because you now start to get an immune attack on your thyroid. The rheumatoid is exacerbated, so the mold becomes a trigger and an exacerbator of the immune system. But once it's there, it is not the target for long-term success. The immune system is the target for long-term success. And whatever it is you got to do to get that immune system down, which may be to calm down your post-traumatic stress syndrome or your fight-flight syndrome or your stress, it might be to fix your gut. But that's what we have seen consistently. In fact, again, we don't even treat these folks for mold because we don't want to delve into the delicacy of having a debate on it when we realize that that may lower people's confidence in what we're going to do, or it may create a stress response in them and make it more difficult for their chemistry to be able to respond to what we do. So we just go with it, and then we just document it, and we go, wow, that person's better. It's an immune problem.
Exactly.
That's it.
And we're highly aware of everything being said in the mold world, from, the mold toxins lodge in the gut.
Yep.
And you got to take all these seaweed derivatives that many of you are aware of, and the chlorostimine, and all these different products to flush this stuff out of you, the zeolite, because we haven't really found that to be a successful approach. Frankly, most patients coming to us are already doing that. And then when we work with them, we get some pretty fantastic results by addressing all these other issues.
Well, the last thing, go ahead.
I want to say one last thing.
Yes.
And so just so you know, just further substantiating our point on the immune aspect of mold exposure, there was a great laboratory that was able to test for this, and they were showing that people had antibodies to mold, and they are no longer allowed to do what they're doing because of reasons we probably won't get into. But just know that it was really substantiated that mold is an autoimmune problem. So the mold triggers these autoimmune responses. Yes, we know the originator of this lab. And it's not even an area where this very, very bright immunologist doesn't even want to get into anymore because it's so contentious. But it's an autoimmune issue. You heard it here. And did you have any other closing remarks?
You probably just wrapped it up. I'll re-wrap it up. But what I was going to say, is that we still, even in the alternative field, are having a hard time getting away from the kill it model.
That's totally it.
And that's why chronic disease is burgeoning, because we're still trying to kill it, stop it, calm it down, alter it. And what you have to do is get the immune system calmed down, not kill the mold. Now, killing the mold's okay, but even if the mold's gone, the immune system is now exacerbated, and the immune system needs to be stopped. So we need to get away from that model, and we need to get more into the functional model of what is causing the present symptoms and address that.
Exactly.
Okay.
So I think that pretty well covers it.
Okay.
If you want to look at the articles we attached to today's broadcast, go to powerhealthtalk.com. Below our broadcast there, you can find all the articles. We hope you found this helpful.
Yeah, and I'm not looking at our Facebook this week.
Exactly.
After the Lyme one, it was kind of interesting too. So,
yeah.
But in all seriousness, we know it's a serious problem. We don't need the lab, but you should read some of the things that we read on after the Lyme one. It was pretty interesting. So, but please do what Dr. Gates said, and look at our references and look at our other. Maybe look at our other presentation online, and you'll be able to see the commonalities as to what we're talking about. So maybe we'll see you next week if you still think we're not crazy. And if you do, we have a couple of other topics we're discussing that we think will be pretty interesting. So see you then.
Thanks for watching.